Say It Loud Network and Mino Lion Media presents Business First.
Hi all, and welcome to another episode of Business First with Sonia Alleyne. I am your host. Today, I'd like to start off with a couple of statistics. The first of which is the fastest growing age group segment of the U.S. population is people over the age of 85. Wow. And according to the last U.S. Census, the age group segment of 65 and over, primarily the boomer generation, grew by a third, which was the largest percentage growth of all age groups during that last census. An aging population will obviously impact a number of industries, but none more than health. So it's not surprising that healthcare, particularly home healthcare, is among the top growth businesses. And here to talk about what the opportunities are in the home care business and to talk about her own journey in that industry as well is Janice Green. But let me tell you a little bit about her. She is the founder and CEO of Jan Care Private Healthcare Services, Inc., a licensed home care agency offering a range of services that include hourly home care, live-in care, hospital to home, and Alzheimer and dementia care. Janice is also a registered nurse with over 20 years experience in a variety of specialty areas. And so when she decided to open her business, she obtained an MBA, but she also is a graduate of WEDC, and we're going to have her talk a little bit more about that, and the Goldman Sachs 10,000 Small Businesses programs. So welcome, Janice. We're glad that you're here and that you can share your story with us. How are you?
Good. Thank you, Sonia, for such a great introduction.
You are welcome. This is going to be a great story. I am, we talk a lot about, what industries we've at, and health has been one that's been growing for a really long time. And a big part of that is because of the changes in our healthcare system, but also because of our aging population. And so was that part of your consideration when you decided to look at this business, or was it really based on your experiences as a registered nurse?
I think as a registered nurse, I realized that eventually we get to the end stage of life and people are living longer because of technology. So years ago, I studied about the aging process and why we live so long, and realized that there's a need also in this kind of business. But to be honest about looking at this business, I never thought I was going to be an entrepreneur running a home care industry business itself. So after I got into the business, I realized how the growth in healthcare with aging over 60 or 65 is 70% or more. And so we realized that this kind of business is going to be a long-term process.
All right. So when we had spoken offline, you had said that, every time you talked about, and we're going to talk about how you actually got into the business, but what I thought was interesting is that every time you talked about this business opportunity, the response from people was that nurses aren't business people.
Yeah, I heard it a lot, even until this day. And there are not a lot of nurses in this kind of business. I actually have 40 power partners that own agency, and I think only 2 nurses.
Wow.
People are actually business, have no background in nursing, so they actually hire nurses to become the director of patient services. Nurses on the 10 are not business owners. They just care for people, and they're not thinking, when I worked at a hospital for 20 years, there was so many opportunity that we could actually do things, create things for people we never thought about that would be a business idea. We did stuff that other company became a business from itself. So on a whole, nurses are not. I wish there would be a lot more nurses would be interested in doing this, because we will get the caring piece to it, and we don't have that piece to it right now.
So because you were told that you weren't a business person, you armed yourself with all of the certifications and the types of degrees that you thought would make you more capable.
Yeah, because the first meeting I went to, which is the chambers, a young lady said to me, what do you think you're going to do differently? There's so many business people out here, and they have the knowledge base, and you're just a nurse and you want to run a home care industry. And I said to myself that I think that was so unfair, because, nurses have more credentials to understand the disease process. And so because of that, I decided to go back to school to to get my MBA. And this is what I said to you. I think the MBA is just a piece of joke. Sorry to say those who have MBA, but nursing will kick your butt. Medical school will kick your butt. But MBA is just numbers. You're just moving numbers in leadership. There's nothing too hard about that. So I think as those who really want to go into business should definitely, take that path. Going to just get some business course like I did. When I was doing my business, my MBA, I didn't understand the business plan. And so they had gave me a project to do in the course itself, but the business plan numbers wasn't matching. So you do it just for the course itself. So that's when I got onto WETC, because WETC had a real business plan. It means the numbers have to mean something. Everything had to mean something. So this was not for school. This was reality. And that gave me that opportunity to realize that, you really need to understand your numbers. And WETC gave me that, which is
wow. So the MBA program was helpful, but it's when you joined, and it's WETC, it's WEDC, is that the program?
Yeah, Women Entrepreneur DevOps Center. And they're out of Washington, D.C., but also cover Westchester. It's a 60 hours entrepreneurial course itself. And basically for those who want to get into business, those who are in business and don't understand business, and those that are in business and stuck. So there's 3 different levels they deal with. And the thing about the program, it's free, and it's because it's a nonprofit. They have a lot of donors, and basically it helps people figure out if this is what they really want to do.
Wow. So I'd like you to repeat that program, because it's a free program to help people understand what stage they are in business. That's worth repeating.
Basically, it gives you idea. WETC, I've been with WETC for the last 7 years. I still give donation to them because I think their cause is really great. You don't have to pay anything to be part of WETC. The process is very smooth, and they take your hand and they show you, is this really what you want to do? And that makes it a big difference. So a lot of people that was in my class didn't graduate because they realized they were not in there for the right reason. So I think that's a big program itself.
Wow. And you said that organization actually really moved the numbers in your business. Like that actually took you.
Yeah, I think when I started my business, it's just ironically, when I was at Betsy, maybe 2015, 2016, I was making like $140,000. And when I did that program, that was the first time I propelled to $2 million. So I thought that was a great opportunity to show me what was I doing wrong. So WETC on the whole, I should give credit to, because they showed me how to do the numbers, how to market, how to do the research. So it gave me that opportunity. I think people should actually look into that program because.
Right. And honestly, I'd like to get some more information from you so we can have someone on the show to actually talk about, how the process and the benefits that people can have. So thank you for that. And you also did the Goldman Sachs program, which is another intensive business program.
The Goldman Sachs is a different program. That's military style, accountability, no joke, no nonsense. You come ready to work. Basically, it's a growth opportunity, and it's whatever business you have. And if you feel like you're stuck, you're not moving, and you want to do something else different, could be part of the same business or not. So it's basically a life plan. I was part of cohort 29, which is the last program that actually had face-to-face. Since then, everything is virtual. But before, I will leave from Dutchess County all the way to LaGuardia on a Friday or a Thursday. And it's all day intense, great teachers, I should say, and dedicated. And they make it happen. That's all I'm going to say. They make it happen. It's alive. And you actually have people who actually making money in the business, because you could be from 200,000 to 5 million or 10 million, just different growth that people wanted to grow in that sense there. So with Goldman Sachs, I still have friends still that we talk from our group each day. We text each other, and just the connection is great. You can talk to your peers and don't have to feel like this person's going to run back to say this or not. I have a classmate just called me and said, I made $15 million last year. So, it's just a great conversation that way.
Yeah. And I think people don't really realize, like, even going into the program, that's a huge benefit, the network that you can have.
Yes. And you're part of a group alumni for all over. So it's really good. And you have those mentors that still reach out to you and say, how are you doing? Do you need any help? What resources you have. When I hear Goldman Sachs, I'm worried. When they say we have to do another class or another program, I'm like, oh my God, here we go again. Torture. But it's good torture, I should say.
And it has benefited you in great ways.
It has. So it has. Like last year, in home care, we were open, so we didn't get the opportunity like a lot of people to stay home. We actually had to be taking care of our clients. And so they reached out to us to see if we needed extra help. And a lot of us propelled last year from the growth plan that we had, and we started to work on it, even though some people were locked down. So some were able to do great work in the process, and some were still struggling, but they're there to support you, and that's what you need, support in this kind of business environment.
Absolutely. So let's dive into a little bit of your journey. So you were working as a nurse, and so what was it that motivated you to even think about starting a business?
So as nurses, we all have two jobs. I have never met a nurse who have one job yet. So, and I was part of that too, in the sense that I work at the hospital and I did private duty as a nurse for another agency. And I was taking care of this guy, wife. She was an ex-CIA agent who was suffering with cancer of the lungs, metastasized the entire body. And she loved me the entire time I was with her for 3 months. And the husband kept saying, "You're great at what you do. You should open your own business." I'm like, "What business?" And he says, "The same thing that you're doing right now." He said, "If I ever get sick, I'll definitely give you a call." I never paid any attention, but a couple of years later, he called and says, "Janice, do you open that business I told you to open up?" Like, "What business?" He said, "The home care business. I fell in Manhattan. I need you to oversee my care. You don't have to be the nurse, but oversee the care."
Wow.
And that's basically how we started from that journey itself.
Wow.
He actually walked my hand through it, named the company, everything. It was just like really smooth transition. So that was a blessing.
So this gentleman who needed care guided you through the entire process from even naming the company.
And he knew exactly what I needed to get done, and he just walked me through. And years later, you move out to Connecticut, and he would still send caregivers to me, so it was weird. So he was always like a connector, trying to connect the pieces together. Yes.
Wow, what a blessing.
Yeah, I think it's a blessing. I always talk about that story because it makes a difference as someone can actually see something in you that you didn't even see yourself.
That you didn't see in yourself. And he saw that it could actually happen because it has.
Yeah, yes, it has.
Yeah.
Thank him for that. Definitely, for sure.
Were you fully confident in your ability because you continued to work while you were building the business? And so was it?
No, I wouldn't say I was fully confident because I had a job that I was making $100,000+ a year. I had my children and my husband, and we had medical plan. I had to make sure this was the right decision. So I wouldn't say I was fully confident. So I still work part-time and I still do the business part-time. But then I realized either I choose between the job itself, because I did from full-time to part-time to per diem, and I still was overwhelmed with even per diem. So I only could go in once or twice a week, and I still couldn't manage, the entire thing. And I said to my husband, I'm going to take a leave of absence from my job. That was the only way I was going to be able to do it anyway. And I did a leave of absence, and I realized I wasn't going to go back. So I sent my resignation after 4 months and said, I'm not coming back. I'm sorry, but this is not for me anymore. But that's basically how it happened. But I had to make sure we had enough money. And this is something I've learned being in the business. A lot of people start business and they don't have the next penny or the next dollar. And so when you don't have that resource, you can get yourself in trouble. So I did save up a lot of money before, maximize my saving. And so I said, just in case I didn't make it in 6 months, I have $100,000. Just in case I didn't make it this, I had that. So that was my thing that I wanted to make sure to have the reassurance. Some people just walk out with no money and did great. But for me, that was my reassurance that I had something before.
Yeah. Was there something in you that thought what was it that you thought it wouldn't work out? Was it something about you? Was it something about the business? Like, what did you think, you know what, this might not work out? Or was it just a general fear that things could happen?
I think it's fear because you're going from the known to the unknown. And Tony Robinson, who I love to quote a lot, will say people want to feel significant, basically. And so I'm getting in a territory where I'm not comfortable with, and it's now that I've been in the business for a couple of years and see different people, and if you want to grow, because not everybody want to grow to the $1 million level. Some people are just comfortable at whatever level you're comfortable. But if you plan to grow and you're going to be in a room, because I've been in a lot of rooms with the only female, only Black entrepreneur, and you have to know that you got to have that confidence to be in that room itself. So it's the fear of the unknown, basically.
How long did you run the business and work? How many years was that?
So 5 years, I would say, before I quit my job. So I left Montefiore in 2014. I got my MBA in 2015. 2000. And I've been on my own since that time. We had a small office in Fishkill, New York, and then we got a bigger office, and now we're looking to get a building. So like stages moving from that. So basically about 7 years I've been on my own.
And so did you feel that you had to get the MBA before you started the business because of all the things that you had heard, or were you doing it simultaneously?
No, because my mentor, which was one of my Professor Myers, he said to me, why did you think you needed to get an MBA to run a business? I said, because of the way people made me feel. And he says, but you're smart already. You don't need an MBA. Not everybody gets up and start a business with an MBA. But I said, well, it makes me feel comfortable. And he says, well, you do good. You know you do a lot more than these kids that are getting an MBA, because I started a business before I went into MBA. So his biggest thing was that I didn't need it. But I think I need it in a sense of me. And now I like to use it too, because people get excited. Oh, you have an MBA. Tell me about my nursing degree, which I have very much. That's my. And
I find it incredible that you said that, nursing is the nursing work was way more heavy for you than the MBA workload.
Praise nurses, because nurses just like going to medical school. We got to know as much as a doctor, but we're not a doctor. Look at it that way. We got to know, and the system of our body is very complex. There is so many diseases in our body from different points. And so if you don't understand the disease process, which is always a pathophysiology, or disease work, you're going to run into trouble. So you deal with lives. As I said to you before, this is just numbers. I can move the numbers, but I can't move the body just like that.
Right. There's no oops when you're dealing with health.
We're dealing with lives. So basically, no oops there, right, for sure.
Yeah. So tell us a little bit about the businesses and the services that you offer.
So Jan Care is a licensed home care agency, which you mentioned. And so we provide nursing. So we had the opportunity to take care of some wealthy clients too, which I won't name because of privacy. Right. And so we provide nursing care, and we provide home health care, meaning that you have an aide in your house anywhere from 8 hours to 24 hours. And that's the kind of service. We have more cases on that level versus nursing. Nursing care, we could do wound care, we can do hospice care, we can do chemotherapy care, we can do vent care. That's the nursing part to it. And then the HHA, which is home health aid, we're actually in the client's home providing care. What we do differently from most agencies is that we have nurses. So in my office, we have nurses that work. So we understand the disease. I really believe that nurses make a big difference. And so I surround myself with nurses. And so if a client have issue, we know how to troubleshoot it before we get to the doctor level. So that makes a big difference if nurses run their own business, and actually a nurse that actually work in nursing, because there's a lot of nurses never been in a med-surg unit, don't know how the body works. So if you're a nurse and you actually work on a unit and you wanted to start something like this, you can reach out to me. I'm here to guide you.
Right. I watched, and I don't know if you've seen this. I was horrified by the show, the Netflix show I Care a Lot, the movie.
I saw it. I didn't like it.
It was awful.
It was terrible. That was not a good representation of nurses, because people always ask me, what would you want to say when you die? What would you want people to say? And I always said I wanted people, she cared. And the reason why I said that, you always have to put yourself in someone else's shoes. And as a nurse, we empathize a lot. We have clients dying, young clients. We had a 35-year-old guy died from cancer. He had more money than anything else, and that couldn't save him. He didn't want to talk about his money. He wanted someone to give him TLC, and that's basically what we do. We actually are there to hold your hands, not somebody who cared that to want to kill you. I'm sorry. That's not nurses. Nurses are not that,
And so I'm glad you said that, because I think for people who have watched the movie, who are not in the healthcare industry, sometimes you tend to think that the industry is more like that than it is than what you offer. And so I wanted you to talk about the importance of understanding the human impact, or understanding how how caring for people is really it's a really important part of, we say healthcare, but the care piece of it is really, really important to what could drive a successful business.
And I can say most of my seniors have some form of dementia, and you can have dementia in different stages. And we have a particular client is like one of the worst stage dementia that you could think about. And this is what I say to the caregiver when she gets really nasty, you just give a little bit of love. You don't have to respond to what she says, because this is a disease. This is not who she is. This is just a disease itself. So we train our caregivers to understand. We have videos, we have talks, conversation. We interact with our caregivers every single day because we want to make sure provide exceptional care, quality care. And that is true that the industry doesn't have quality care sometimes. But because we have too many people get sick, like too many, look at what happened in 2020 with the pandemic. We don't have the manpower to care for all this. So we lose the real caring aspect of caring.
Right. So do you also have to, and I guess this is where the management pieces and the business pieces come in, because you have to manage your staff and you have to do a lot of training.
Yes.
As well.
Yes. I mean, the business piece, I mean, I'm not saying MBA is the worst thing, guys. Please do not hear this, but I'm saying that the leadership in MBA is really good because it focuses on leadership.
Right.
And then the piece about understanding your numbers is good because you want to know what your profit margin is. You want to know what's going on with your expense and stuff like that. So that piece is good. But to be in a field like nurses, like other power partner who are not nurses, they get nurses, and sometimes they said the nurses doesn't understand the business part to it. And because the nurses are so more focused on caring. So it works together. So yes, it'll be good to have some business, not an MBA, but a business degree or some kind of business where you understand certain things. Because I've looked at a lot of business people who want me to invest in their business. And I'm like, you got to do your research and come back, basically, because you really have to understand business as a whole itself.
So what is the biggest thing, or one of the biggest lessons you've learned on this journey?
I would say being resilient in the sense that when it's going to get tough, no matter what business you have, you're going to have good moments and you're going to have bad moments. But you can't give in when you have those worst moments. Like for us, we had a lot of people dying last year. Like they're dying like flies. You know, I'm not going to pack up my bag and say, enough is enough. I can't deal with this. You have to stick it out. And then there's sunshine the next time around. So basically you got to be resilient. No matter what happened, you're going to stand to it. That's the reason why being in home care, you have to love what you do. If you don't even waste your time, because you're going to have patients that get on you. You're going to have caregiver that get on you. You're going to have your regular staff that get on you. And then you're going to have somebody else getting on you. So you have different people, so you want to make sure that it's something that you really love. And then when you have those bad moments, you just take a smile and keep moving. And when you have those good moments, you celebrate. That's it in this field itself. So if you want to be an home care CEO, or you want to run a home care agency, or want to start your business, just make sure it's something that you really love.
Because to your point, your interpersonal skills, your communication skills, because again, offline, you talked about all of the different people you have to engage with. So I think it's not just the patient, it's the patient's family.
The patient family, you have the patient, and sometimes the Italians, they have a lot of families. Italian, Spanish, they have the most family you could ever think about. So if you have one person who's in charge, but then 10 other family member wants to be in charge, so you got to deal with 11 right there. Then you have your caregivers that you have to deal with. Then you have to deal with your in-staff and in the office staff that you have to deal with. And then you have all these partners. So you have attorneys that you have to deal with. You have the workers that you have so many people that you get involved with. That means you really have to be focused, when you're doing this kind of business itself.
And your business is not just, is it localized or is it?
So right now we service Westchester County. So our location is in Dutchess County, but we actually have Dutchess County, Westchester County, and Putnam County. Those are the three counties that we serve. I did go into New Jersey, but I think it was just too much at a time. But right now it's just Dutchess County, Putnam County, and Westchester County.
Okay. So have you ever thought about franchising, or is it a business that you could franchise?
No, because I want to keep this model where we care, in a sense that I find that, a lot of people, they have asked me that before. I think we're not the typical agents that want to have 100 care clients or 200 clients or 300, because we lose the focus itself. And yes, you could hire people to oversee this and oversee that. But for us, we realize that we give that specialized care. We're not Medicaid, so it's private paid. So basically, you got to have money. So it's private paid and long-term care insurance. Those are the two things that we take. So if you don't have more than $100,000 or more for care, you're not going to get the quality care that you deserve. And this is how it has been. And it's very hard for me sometimes to look at it that someone saved up the money for 401k, $500,000, and in 5 years gone because someone is taking care of them. But this is the business. So if you want quality care. So right now, I don't think about franchise because we want to make a difference in nursing.
And what's interesting is, I think when you think of home care, you always think of the elder, but you mentioned the 35-year-old.
Oh, I range anywhere from 30 we have a lot of cancer patients, 30s, 35, 40, 45 people going for surgery. I had tummy tuck. I had a lot of gallbladder surgery. Sometimes people just want TLC. Somebody I had a nose job and want to make sure we have a nurse there just in case my nose bleed. So it's a kind of care that it's not just aging. We do a lot of surgical patients. We got a lot of people that does chemotherapy for different reasons. So it's not just but a lot of time people just think it's just for seniors, but no, it's not just for seniors. You have surgery, planning to have a hip surgery. You're 40 years old or 44 years old, and you want to get back so you can get back on your feet to go back to work. You hired someone that knows exactly to get you back on your feet, which I've done quite a few times. We know we're going to be in there for 2 weeks, 4 weeks, or 6 weeks, and that's it.
What has surprised you most about this business and this journey?
Surprised me and most people on the whole. I mean, in this business, a lot of our caregivers are, and I didn't want to even do that. I mean, I wish I didn't have this question, but sometimes they will see me as the CEO and not realize I'm Black. And then my caregiver, who is Black, can be a problem for them. So they see me differently from they see my caregiver. So it surprised me, but we take no offense to it. We're here to provide the best quality care for you. But we had those moments that I said, if you can't accept my caregiver, you can't accept me either. So
I was going to say, so have there been times when you've had to terminate service?
Yeah, there's time I just decide not to because I know that they will make the caregiver feel less than who they are.
Wow.
And so I don't want to put someone in that situation. So that surprised me. I treat everyone as a person,
right,
and I'm going to provide the best quality care for you. And I think whosoever I'm going to bring to your house is going to do exactly like me because they're actually a part of me. And so if you don't love my caregiver, then you can't love me. And
I'm curious, has somebody been audacious enough to say what it is? Wow.
Of course. They say to you, what kind of people you hire? And so we said we have Spanish, Chinese, white, Black. Oh, can I get the white one? Can I get the Chinese one? Can I get this? So yes.
Wow.
Bold. And sometimes it's not the patient, it's the patient's family member. So it's not the patient sometimes. But I must say that 99% of my clients are white. So the 1%, or I should say 0.1 that are Black, this is the business. Not everybody the same. Some are and some are not. Those I don't have around me at all. So
right. And if you're dealing with the public, you're always going to deal with some sort of discriminatory something at some point. So. If you're in business long enough.
So that's all it is, a learned behavior.
Yeah. So what do you think is next, or what would you like to be next for your business?
So right now in the pipeline, I'm trying to get a land to have 20-bedroom apartments. It's called independent living. So basically, it's not a facility, it's apartment, luxury concierge apartment. Looking at it right now, that's a project. And we'll have those eventually when they need care, we'll have the home care part to it. So that's my thing that I'm working on right now. It's a growth opportunity for me where I can actually do that. And then also I do case management. So a lot of people don't understand the complexity of healthcare. So we have these care managers, which is I am a care manager, and we handle every aspect of your business. So your home, your money, everything else. And some people hire care managers because they don't want to deal with the headache of complexity of everything. So we get a lot of cases through attorney, guardian cases that they don't have any family or they have family, but they don't want to be bothered with this. So they hire care managers. So I do that piece. So now my next project is to have a 20-bedroom apartment, concierge service apartment for seniors.
That is such a natural extension from what you do.
Yeah, I think now that I see the growth that last year when a lot of people were locked in facility, that was the biggest concern. If I could get my mom out. So this is not a facility, it's an apartment. You can go there and visit. And so basically, a lot of people don't want to be home alone either too. So this will be, they can able to have, activities together and stuff like that. So that's where I'm going to be.
It's like it's a living community.
Right. But it's a little bit high-end living community where I have the place, the drawings and everything ready. We're just, going through the things. But that's the goal to do. And I think hopefully next year sometime we'll have a building ready to go for that.
That's great. What would you advise to people? So like I said, in the beginning of the show, this is one of the growth industries. And as you pointed out, which would be interesting for our guests to know, for our listeners to know as well, is that you don't have to be a medical professional to have a business like this. Also the important point that you've made too is that you would encourage nurses or people in the medical profession to consider a business. And so what should folks think about going forward if they are thinking about starting a home health care business?
So the first thing I always say, do your research. So there are certain states, and New York is one of those states that are highly regulated. I have partners in different states, and the things that we have to do, they don't have to do. So in New York, you have to be a licensed home care agency to get patients from hospital setting, nursing home setting, and assisted facility. That's regulated. So basically, how you're going to market if a lot of agencies are out there that are companion care, they don't provide the nursing part to it, and they don't provide any kind of skilled care to it. So those agencies can get clients without having to deal with regs, but those who want more to it, you have to. And then to get the license takes about 5 to 7 years to get this license from the state. And then once you get the license from the state, you have all these things that you have to do. And that's one thing I wanted Governor Comer, if he's listened to this message, that you got to look at those regs. It's just too much for us. We spend more time doing paperwork than anything else. And other states don't have to go through this that we have to go through in New York per se.
So New York has intense regulations, but it varies from state to state.
New Jersey, California, Massachusetts, and Pennsylvania. And other states don't have that. So anyone in New York that wants to do it, it's out there, but you just have to do your research and make sure that you're up on all these things that they talk about. Otherwise, they take the license away from you. So you have to make sure do your own research before you start home care business itself. And it comes with a challenge, and it comes with any business. But sometimes I say it's easier to take care of the garden because you only have to do is talk to the flowers. But when you talk to home care, you have like 10 different people to talk to. So just do your own research on that.
Okay. All right. So how can people find you?
They can find me on the website, on my Facebook, jancareprivatehealthservices.com. They can call the office 845-896-5300. I'm on Facebook, Twitter, LinkedIn, all the things all the social media. You can find Jancare, Janice at jancareprivatehealthservices.com.
Well, thank you so much for coming on and sharing your story with us. We wish you all the best and want to hear the updates on the luxury condos. Are they condos or would it be?
Luxury concierge apartments for seniors. In
luxury concierge apartments for seniors.
Of Dutchess County. Come and join. Yes.
Okay, very good. Thank you so much, Janice.
Thank you for this opportunity. I appreciate it. Thank you.
You are welcome. And for those of you listening, thanks for always tuning in. And please subscribe and continue to listen. We are available on wherever you get your podcasts. Thank you. Take care.
Bye-bye.
Business First is hosted and produced by Sonia Alleyne. Associate producer, Lauren Turner. Edited by Ken Johnson. Executive producers, Omar Thompson, Andrew Kalb, and Ken Johnson. Find the Business First podcast on Apple Podcasts, Stitcher, Spotify, TuneIn, or wherever you get your podcasts. The Business First podcast is a Mean Old Lion Media and Say It Loud Network production.